In the United States, approximately 120,000 infants are born with birth defects every year. Because they are born in the United States, these infants receive the proper care they need. In underserved areas, infants with birth defects don't receive the same care and can grow up with malformations.
I'm Petty Officer Jonathan Davis, and for several days I had the privilege to follow 3 young patients and their mothers through their journey to receive medical care on board hospital ship USNS Comfort during our time in Peru.
Please be aware that there are actual surgeries being performed during this video. Viewer discretion is advised. This is Kelly and her 2-month-old baby Tommy. Tommy's behavior might seem like any nervous baby being examined by medical personnel, but they are here about his cleft lip and palate. According to the Center for Disease and Control Prevention, cleft lip and cleft palate are birth defects that occur when a baby's lip or mouth do not form properly. Both develop in early pregnancy.
It develops in uterine, usually between the 8th and 12th week, depending on whether it's cleft palate or cleft lip. The etiology and the cause of it is sometimes, I think, it's generally considered a congenital defect, but there are evidence that it may be nutritional, so it may be more prevalent in underdeveloped countries.
Meanwhile, Mari is another woman who brought her scratching 1-year-old daughter, Armenia, to receive help with her cleft lip. Although not as drastic as Tommy's cleft lip and palate, as Armenia grows older, she could face being ridiculed by her classmates and those around her. Our last patient, 6-year-old Erica, knows all too well about being teased.
Our little girl here, she has a syndrome known as polydactyly. That just means she has too many digits. In her case, she has an extra digit on each hand and on each foot. There is a problem associated with that, is that this is an abnormality that is clearly visible, particularly on the hand. And as a result, kids tend to be a little bit cruel when they're growing up, and this puts her at a disadvantage because then they tend to be made fun of, and it sort of pushes them to the side of society a bit.
After a thorough medical examination and health assessment, continuing upon its 2011, medical doctors approved the 3 patients for surgery.
That's not tolerated in the United States, and it's nice that we can get out here and do some help for those people.
The next day, patients who were approved for surgery begin to make way towards the theater. Our patients and their mothers are also within this group. All of them are packed with necessities to help them get through the next few days away from home. As they wait patiently, the mothers have a worried look on their faces, waiting for what's to come next. What they don't realize is the next time they step foot on land, their lives will already have changed for the better. The boat arrives, and civil mariners prepare to stabilize the boat pierside. One by one, the mariners carefully help patients board the vessel. For many of them, this is the first boat ride they have ever been on. As they capture the moment with photos, the boat's crew makes sure each and every one is safely fastened with his life vest. With everyone ready to go, the civil mariners and the patients set sail and begin to cross the water. Their next location, the hospital ship USNS Comfort. Our patients arrive on board the Comfort. Their first stop is towards the CASREC waiting area.
CASREC stands for our Casualty Receiving Area. This is an area where people are brought on board. They're greeted. We sort through the people that come through, find out who is who, find out what their concerns were, what surgeries they were planning on having, and start the admission paperwork. It would be sort of like patient administration or the check-in place on a standard hospital.
After taking care of all the required check-in procedures and then receiving the time for their appointed surgery, our 2 young girls, Armenia and Erica, get a chance to show off their artistic side. Meanwhile, Kelly and her baby Tommy begin to make way towards the Comfort Inn.
Well, one of the things that we like to do is to have the patients become acclimated, get accustomed to being in a brand new environment. And the Comfort Inn is set up sort of like a hotel room where they're just going to be there overnight. They'll get their instructions, nothing to eat after midnight, opportunity to get a shower, get appropriately dressed for the operating room the next morning, and just a chance to get in early and try to get a good night's sleep.
It's the next morning, the day for our patient's surgery. In the pre-op holding area, Kelly and baby Tommy spend one last moment before being taken away for his surgery.
La mejor hospitalidad. This is the best hospitality I've ever received. And we don't have any family here and don't know anybody else. The crew here treat us like we're already family. I'm very grateful with everyone here because they are very attentive by asking us if we need anything. They communicate everything that is happening in regards to the care of my baby.
Now, in the care of doctors, nurses, and foremen, 2-month-old baby Tommy gets induced with anesthesia. The surgery is now set to begin. With time-lapse photography, the 2-hour surgery goes by in seconds.
You usually do it in a 2-stage operation, but it's a lot of surgery to repair it. If somebody has a complete cleft lip and palate, it's a lot of surgery to be performed at once. When they have both of them, you really want to stage it. You want to do the first one when on the skin itself, because the younger you operate on somebody making cuts on the skin, the better they heal up, so the scars are better. So it's less surgery and you get better scars. So you do the lip first. And then you do the palate when they're a little bit older and they have more growth involved. You usually do that at anywhere from 6 to 9 months. So you definitely want to do it before they start learning to speak, which is definitely before 18 months. That's what we do in the United States.
With the surgery a success, baby Tommy is rolled out of the OR to the ICU. His mother follows, upset to see her child in such a vulnerable state.
Bueno, yo mi corazón. When I saw my son coming out of surgery, I felt my heart racing, and it didn't know my throat. He's so young, and I was sad to see him go through this. But when I saw his face for the first time after surgery, I was happy.
También ya, ahora me siento muy feliz.
Meanwhile, Mari and her 1-year-old daughter Armenia wait in the pre-holding area. Little Armenia is nervous for what's to come. Next to them, 6-year-old Erica and her mother Maria also wait for their surgery.
The surgery will give my child happiness and a normal life. When she was born, I would see her touching her lip. I would tell her that it's okay, that she was beautiful. But reality would hit me. I was afraid that when she would get older, other children would tease her at school. I kept telling her everything's going to be all right as she was crying and nervous. I want her to be happy.
Erica's mother Maria knows how hard it can be to console and encourage your child after being teased.
There was a time that a little kid didn't understand her situation and would tease her. She came home crying and told me to get a knife and cut off her fingers. I told her, no, sweetie. One day there will be an opportunity that a doctor would come and do the surgery. Now the opportunity has come and we are here.
Both Armenia and Erica's surgeries take place simultaneously.
This particular case, Dr. Tim Nickel was working on the right side. I was working on the left side. The surgery goes twice as fast, and then we're able to give her the appropriate results.
Little Armenia begins to wake up after a successful surgery on her cleft lip. As the surgery team lifts and places her gently on a gurney, Captain Honig shares his thoughts about a smile.
There's nothing beats a smile, especially a kid that doesn't smile a lot. And it's probably the most rewarding thing in my professional life, is to see the reactions of the kids, mainly the moms. The moms are unbelievable.
Several have different emotions, but the one that stands out is happiness because of the surgery they did on my daughter. I still can't believe it. I'm very surprised. I'm very grateful, and I will never forget all of this. I am very emotional, and I feel like I'm going to cry. I'm very, very grateful because they treated us so well. Everyone here on Comfort are some of the best people in the world. I believe God sent you all here to help us, and I hope as you continue with your journey to other countries, you will continue doing the same great work toward those in need. I hope to see the Comfort again.
After several hours in an operating room, 6-year-old Erica finishes her life-changing surgery. Her mother is thankful for all of this.
Sincerely, you have all changed my daughter's life. I've always waited for this opportunity because I didn't have the money for her surgery because this is a very expensive procedure. Now, I'm very happy because I see her so happy. I'm eternally grateful to the Comfort and its crew.
Captain Todd visits Erica to see how she is doing.
We counted her fingers the night before surgery. We counted all the way up to 6. Tomorrow in Spanish, I told her she could only have 5.
After a couple days of recovery, Tommy, Armenia, and Erica and their mothers begin to make their way back home. The several days they spent on board Comfort will always be a lifetime of memories.
The big thing that I see of what we're doing here is this ship and everything that we're doing on the ship and what we're doing ashore represents the human touch of America. We are coming here and we're helping people at the very individualized and personal level. Within the whole of this ship, we are doing life, family, and community-changing surgeries.